This is a standard 20 gauge cannula. We would advise you using a 20 gauge cannula or a 22 gauge cannula, which is blue in colour, when you first start cannulating. Remove the safety sheath, which exposes the sharp insertion needle surrounded by the catheter. Remove the bung at the end of the cannula and place within reaching distance before you attempt cannulation. Ensure all parts of the cannula are moving really nicely before you attempt to cannulate to ensure good movement. Once the cannula is placed, you can see that the insertion needle then becomes safe with a safety stopper at the end. When cannulating the antecubital fossa, place your tourniquet an appropriate distance above the vein you're aiming for. Get the patient to open and close their fist, and gently clean the area with an alcohol wipe for 30 seconds and allow to dry. Insert your cannula into the lumen of the vein at 10 to 15 degrees. Once you're in, level off and retract the metal needle slightly, but still keeping the metal needle within the cannula itself whilst extending it to keep it rigid. Ensure you have gauze underneath your cannula for any spillages. Remove the tourniquet and then place your bung back onto the end of the cannula, whilst clearing up any spillages that may or may not have occurred. Next, whilst holding onto the cannula, get your flush, which should be normal saline, open the cap on the top and flush with 2 to 3 mils to ensure the correct position of the cannula. Finally, place the dressing to secure the cannula.